Hello, my name is Dominic Hardisty. I'm Chief Exec of AWP, and today, as part of National Carers Week, I'm talking to you about the importance of carers. I myself have been a carer a couple of times in my life, most recently for my father-in-law. In the last couple of years of his life, he had dementia and a number of physical conditions and was in and out of hospital, and we cared for him right up until he sadly passed away. So I know from personal experience the real importance of involving carers in somebody's care, both to improve care for the patient, but also actually to make it easier to deliver care. Because if you understand the context around somebody, then it's easier to kind of meet their care needs in a way that really works for them, and that can be quicker and easier for us to do. Now, as a trust, we are committed to something called the Triangle of Care. We're delighted to have 2-star accreditation under the Triangle of Care. And this is really a national standard for the sorts of things that a mental health trust needs to do in order to make sure that it's taking carers into account in the design and delivery of care. Things like making sure that carers are identified at the beginning of a patient's journey, that they're supported, that staff are well trained, that there are nominated roles, range of materials available, those sorts of things. It's kind of common sense, but it's a good set of standards, and it's something that I've implemented a couple of times in other trusts that I've been in. So I'm really proud that we've done that here as well. What I also do notice, however, is that it was some years ago when we implemented that at AWP, and like many things, it goes a little bit off the boil if we don't give it our attention. So I'm making a pledge and a promise this week as part of National Carers Week that over the next year we will give it a real shot in the arm. We'll give it a new energy and a new focus. And I hope this time next year to be able to bring everybody involved in the Triangle of Care, whether they're carers themselves or some patients or some of our staff who are carer champions and leading on the work around Triangle of Care, bring everyone together for a conference in time for Carers Week so that we can celebrate what's going well and share those stories, but also support people who might be finding it a little bit more difficult to implement and sustain the work needed in order to make sure that Triangle of Care is really at the heart of service design and delivery. So over the next year, I really hope that you'll see us redouble our efforts and really re-energise everything that we're doing. So just before I finish, I would like to say thank you to everybody who's doing this important work, and in particular, thank you to you, the carers yourselves. We can't do this without you. We need you. We need the best that you can bring, and I hope that we do our very best to support you. But thank you for everything you do for all the people that we look after on your behalf. Thank you very much. Goodbye.